Welcome to our Wellness Wednesday Health Show. I'm your host, Dr. Kala Hewlett from the Back Pain and Joint Center of Texas, where we offer non-surgical solutions for your back and joint pain conditions. And the purpose of this show is to introduce you to health and wellness professionals who are committed to helping you get healthy and stay healthy in a more natural and holistic manner. And today I have two very special guests who were part of our TransMed Wellness Expo that we just hosted last month. Today I'm here with Dr. Teresa Scott and Dr. Perry. Welcome to our show today.
Hi, I'm Dr. Teresa Scott.
And I'm Dr. Rachel Perry. Nice to meet you.
Nice to meet you.
And they are what is known as holistic biological dentist. Now the first question is, what is a biological dentist and how's that different from a normal dentist?
So a biological dentist is very cognizant of the oral systemic health connection, right? So what that means is there's a huge link between oral health and systemic health. And one of the most obvious things in the literature, like in PubMed, right, is the link between gum disease, heart disease, diabetes, and stroke, right? So it turns out that there was a study by Dr. Brad Bale and Amy Doneen. They wrote a book called Beat the Heart Attack Gene, okay? And in that book, they're geeks. They're 100% geeks, and they were studying like what was causing people to have heart attacks and strokes. And what they found was one study showed that 78% of the blood clots from strokes and embolisms have the bacteria in them associated with dead teeth.
Oh my goodness.
Right? And then another study that they did showed that 50% of all heart attacks were caused by active oral infections.
50%.
50%. So
this is something
those are
that,
big numbers.
Yes, in mainstream healthcare professionals and just, we'll just say the average individual has no idea.
Correct.
Yeah.
None.
So how does the bacteria that's in our mouth, how does that go on to systemically affect things like our heart?
Well, other than the obviousness that of everything being connected, and then the bacteria being present and just overall health, and we're really big on finding the root cause of issues. So we want to find what's your root cause and consider the whole health, and it starts in the mouth. And I mean, gum disease is, I think, what, almost 70 to 90, it's a high number.
75% of people have gum disease
and don't know it.
Dentists don't bother to check.
Yes. So that's where it starts. It starts with really evaluating gum disease and to get that bacteria count under control. And being biological dentists, we do it with ozone therapy, which is amazing and less harmful, and it's not using a lot of the harsh chemical products that are out there. And then we also do laser therapy for taking care of that first.
So when you talk about gum disease, and again, just experiences that I've had with either for myself or family members or friends, typically someone will go for an annual cleaning, right? Maybe every 6 months or every 12 months. If they have a cavity, then they'll address that. But very rarely have I heard the talk of gum disease or bacteria for most healthcare professionals in the dental field. Is that something that is unique to the biological dentist, looking at the bacteria?
So, no, it shouldn't be that way.
Right.
Because the honest truth is that, the Bale Doneen movement is really affecting all dentistry. But unfortunately, it's, slow growing. And so biological dentists are all about looking at root cause. We want to know, okay, so you've got health issues. Is there something in the oral health that's contributing to it, right? So I have had patients who have, and Dr. Perry has too, we have videos that are amazing, where all we did was just take out a dead tooth, and all of a sudden the person's health improves dramatically. Like, we're not talking tiny little improvements. They go from, I couldn't walk, to 2 weeks later, I have energy, I'm walking, I worked in the garden for 5 hours.
Right. It just shows how connected the whole human body is. When we say the word holistic, I know I was talking to some friends recently, and I said something about holistic and just what we do in our practice, and it was about an hour later in the conversation, they're like, now when you said holistic, I was picturing like hippies and like energy medicine and like something that was totally out here in left field.
Right.
In reality, when someone hears what holistic, how would you even describe just the holistic approach?
Well, we try to minimize chemicals, but in dentistry, let's face it, there's nothing natural about dentistry.
Right.
Right? Fillings, crowns, bonding agents, there really is nothing natural. Everything we do is prosthetic, right? In some way. It's either a piece of a tooth that's prosthetic, or it's the whole tooth that's prosthetic, or the whole, all of the teeth that are prosthetic, but everything we do is prosthetic. So the key is to maximize that compatibility, right? In terms of what holistic is, it's trying to approach things in a way that minimizes toxicity, maximizes biocompatibility, and enhances health as opposed to making it worse. For example,
When you put it that way, that sounds so elegant and it makes sense.
correct.
Right.
So, for example, amalgams, mercury fillings, right? They are 50% mercury.
Mercury.
So in dental school, we were told, oh, you're fine. You're only releasing the mercury when you're putting it in and taking it out, and it's not that big of a deal, etc.
And for years, right, the American Dental Association, that was their stance, I believe.
Oh, it still is.
Still is.
It still
They
is.
still support it.
Yeah, they still support. They're like, oh, it's fine, but even though in 2020 they came out with, finally, they came out with, okay, maybe you shouldn't use amalgam on pregnant women and children under age 6. And I'm like, is there a magic day they were 6 and all of a sudden they were 7? Is there a magic day when mercury becomes safe?
And even having to put in special equipment within the dental office called a mercury separator to make sure that we're not putting mercury into the environment. Yet it's okay to be in our mouths.
In our mouth.
So we
So have
function with that as a knowledge of toxicity in that way. And touching base with what she said about not much in dentistry is natural, but we have a really good understanding of what natural is and how to counteract the unnatural things that we need to do for our mouth and our health.
So having an unnatural substance like mercury in our mouth, and I venture to say, gosh, the majority of people watching this probably have an amalgam filling in their mouth.
For sure.
Unfortunately.
And so what is the concern, the danger of having that amalgam filling and mercury in the mouth?
So in dental school, they told us that mercury was only released from amalgam when you put it in and when you take it out. So unfortunately, that's not true. It's every single time you chew.
So I'm having lunch, I'm chewing,
Correct.
I'm
You are
chewing gum
brushing
and brushing
right.
my teeth. So
Right, and there
Drink
are
something
videos
cold, drink something hot.
so
Correct.
small amounts are continuously being
all
released.
the time. And
Yes.
there's videos on YouTube that you can find, or that the IAOMT, International Academy of Oral Medicine and Toxicology, they have put together some videos. The International Academy of Biological Dentistry and Medicine, they've put together videos. So there's several organizations dedicated to trying to spread the word.
Yes.
So someone that has multiple amalgam fillings,
Right.
it's even higher amounts of mercury that's being released.
Yes.
Correct.
What
And it's
are-
every single time they chew.
And it must be removed in a safe way. And you want to make sure you find a dentist that is certified, a certified biological dentist in, it's either called the SMART protocol or the PROTECT protocol.
depending on the organization.
What are
Yes.
some of the common symptoms? And I know there's several, but the common ones that someone who may have mercury toxicity due to their amalgams.
Stars. I had 63 of them at my sickest.
63 different symptoms.
63
my goodness.
symptoms. So gut dysbiosis, some people experience dizziness, insomnia, severe candidiasis that nothing can resolve, chronic fatigue,
Brain fog.
symptoms of ADD, etc., that aren't responsive, anxiety, depression, hormonal imbalances.
So, and the list goes on and on. So
Yeah,
many things
there's like
that again,
100
you
different symptoms.
if you didn't know, you wouldn't connect those to an amalgam filling. You're seeing all these different healthcare professionals and specialists, and sometimes even prescribed medication where it just creates this toxic soup.
Correct. So,
Correct.
for example, one of the things, some people come to see us for their amalgam removal, and super careful because I've learned the hard way that one teeny tiny amalgam removal on a person who is not ready yet to have their amalgams removed can throw their bodies over the edge.
Okay.
One tiny little one done correctly can throw a person over the edge. So for example, if I have a thyroid patient, and they've got Hashimoto's, or they have just plain old hypothyroidism and it's not Hashimoto's, etc., one tiny little amalgam can throw a person over the edge.
Push that. Oh.
So I always ask my patients to please work with their functional medicine doctors. I think it's important to work with a functional medicine doctor. Let that doctor tell us when they're ready. They've maximized their elimination pathways, their methylation pathways. They've tried to really maximize everything they could, right? And then there's also, working with somebody who understands and can give a person things like IV glutathione, et cetera, to help them detoxify. Because it doesn't matter how safely an amalgam is removed. Sometimes even just the tiniest bit will throw a person over the edge. So we've got patients, for example, who have Crohn's disease, right? And they went to another dentist, had their had some amalgams. They didn't have all of them removed, just one or two or whatever, had them removed, and it threw them into a flare.
Because
I'm not interested in throwing somebody into a flare.
There's that threshold, and without understanding how far they are from that threshold, just a little bit pushes them over that threshold line.
So I ask them to work with a functional medicine doctor.
Yeah, as you're talking about this, I recall a patient several years back who had their amalgams removed by their friend who was a normal dentist. Just said, hey, I recently heard they weren't bad before, but the dentist said, I've learned these are bad. I can take them out for you. And unfortunately, he wasn't certified or trained, so he took them out. And this individual, it was about 18 months that they were just in a complete tailspin with their health because of the mercury exposure and the improper removal. So I am very glad that you guys brought that up. How can someone, you mentioned SMART, if someone's watching this, how can they connect with someone who is certified and that is properly trained in removing the amalgams?
So I'm president of the IABDM, International Academy of Biological Dentistry and Medicine. Okay, I was appointed, whatever you want to call it, but it was like literally right before COVID started. Like March is when I was appointed, and April was when everything shut down. Right, so about 3 weeks before. The IABDM is actually headquartered here in Houston. And so their website is IABDM.org, right? And they have a list of certified biological dentists in the Houston area. If you're in Houston, but if you're not in Houston, if you happen to see this and you're not in Houston, they actually have a list of certified biological dentists from all over.
We'll put a link. We'll put a link so that way you guys can search there.
There's not a lot of them, and there's an awful lot of people who are at the beginning of their journey and they don't yet understand how important it is, or they're just, unfortunately, there's unscrupulous people out there who are doing lip service to it because it's cheap advertising. So the IABDM made a very, very concerted decision to remove those who are not certified from their website.
So if someone's on the website, it's not someone who just paid dues and got on the website.
So with the IABDM, there's something that will say certified biological dentist. Now, the International Academy of Oral Medicine and Toxicology, IAOMT.org, they have dentists who are SMART certified. And again, the problem is there's an awful lot of people who go and they do the certification process, but they may not necessarily have all of the understanding.
More full extensive knowledge.
So if a person is going to go through and do amalgam removal with a SMART certified dentist, look for one that is SMART certified and accredited, not just
SMART
certified,
and accredited,
and that they've gone to a minimum of 2 meetings, because the IAOMT actually says how many meetings their dentists have gone to. So if they've not gone to at least 2 meetings,
so you can see how involved they are.
Exactly. You want to see if they really buy into it or if they're doing it for advertising. Because there's plenty of people who are doing things just because it's cheap advertising.
If you're in the Houston area, I'll just tell you this. we'll put a link to Dr. Scott and Dr. Perry's office. That way you just connect directly with him. Again, she is the president of the
IABDM.
Say that 3 times fast.
Right.
So mercury, amalgam fillings. What are some of the other, I guess, more common things that the average person should be aware of when it comes to their dental health?
Well, airway is a big one.
Okay.
So
Breathing is life.
right,
And
you don't breathe, you don't live.
And it starts, but
No.
it starts really young. We really like to evaluate kids, and it's all about, your tethered tissues, tongue ties, lip ties. Those are not noticed and looked at as prevalent as what we see them as, because we're looking at it as the development of your face and the development of your jaw. And because we tell people all the time, if your tongue's not sitting in the roof of your mouth, pushing your jaw forward, it's back into your airway. So we're very passionate about that.
So you'll see children here as well?
Yes.
Yeah, we see
So
children
you're
from birth on up.
Okay.
Yeah.
And the earlier you can catch airway issues and diagnose them when kiddos, it's so much easier to help them grow when they're young while they're growing. But we can grow adults also. It doesn't just have to be children.
Yeah. Now there are people who are not good candidates to grow. They have severe enough issues with the sleep apnea and so on and so forth that they need more. Our commitment to our patients is that we are determined to help you, even if it's not us who does the work.
Absolutely.
And somebody's really truly committed if they're not gonna be getting anything out of it.
Correct.
Potentially. If I can help you, I'm happy to help you, but I may not be the one who
If
needs
not,
to
you'll
help
point them in
you.
the right
But
direction.
we get to point
You
them in the right
mentioned
direction.
sleep apnea though, and I know that's more and more people I talk to, it seems like they suffer from some degree of sleep apnea. Is that something that can be connected to airway?
100%.
It's so grinding, clenching, gritting, snoring, sleep apnea. They're all arms of the same beast. Okay, so I use this analogy with my patients all the time because it makes so much sense. Try to imagine that your tongue is a 6-foot tiger and your teeth are the cage. Okay, if you have had 4 bicuspids extracted, because 2.5 generations of people have had 4 bicuspids extracted, right? Your cage is very small, even if your teeth are straight, right? Okay. If you have crowded teeth, your cage is smaller than your tongue can support.
Yes.
So if you have a 6-foot tiger trying to stuff itself into a 3-foot cage,
That is your job.
that cage will try to clamp down, that's the clenching, right? It'll try to adjust itself, that's the grinding, right? So it'll try to do all of those things, and that 6-foot tiger still will not be able to stuff itself into that 3-foot cage. So it's back here. Where do you think that tiger's butt is sitting?
Got it.
Back in the throat. Correct?
Yeah.
And this is something that we see so often that we send patients home with sleep studies daily, like literally daily. We don't do the diagnosing. So another thing that Dr. Perry and I are very passionate about is making sure that we have our checks and balances in place. So we have no desire to do surgery without checking if a person really needs it, right?
Okay.
We have no desire to do treatment on a person if they don't actually have a problem, right? So the sleep study is read by a board-certified sleep medicine doctor, and they are the ones who do the diagnosis. That's our checks and balances, right?
Okay.
Our compatibility testing and our meridian stress assessments are read by Dr. Dawn Ewing, right?
Okay.
She's really amazing, and if you've not interviewed her, I highly recommend her. So do you remember the movie Root Cause?
Yes.
So she's in the movie. She's the bright
Okay.
redhead. She's a doll, and she's
Okay.
5 miles from here.
Yeah.
So we refer to her a lot.
Stay tuned. We'll be interviewing coming soon with her.
Yes.
We refer to her a lot for the meridian stress assessments and the compatibility testing, very specifically because, again, checks and balances. She makes certain that she does her testing, and that way we're not doing unnecessary things,
Okay.
Yeah.
right? She's really wonderful at explaining that oral systemic health connection. Again, myofunctional therapists, we refer to myofunctional therapists for tongue ties and so on and so forth. Why? Because who the heck wants to have to go through surgery to cut their tongue, right? The frenulum, if they don't have to.
Right.
So rather than me saying, okay, you need a tongue tie release, I'm going to have somebody who that's all they do, expert in the field, say, yes, this really does need surgery, or no, I think we can just exercise this.
Right. And then
so
that
checks and balances
Yes.
matter.
I love that principle. I think that speaks to just your passion and truly integrity of really wanting to help the patient
Yes.
and making sure this is their best interest.
Exactly.
So that checks and balances. I
Right.
love that concept.
For sure. Yeah. And I was just saying that with myofunctional therapy, the exercises are extremely important. It's similar to, you get an adjustment. You still have to do your proper stretches for your body so that the myofunctional, that's what's the beauty about being in the holistic medicine world, is that we all work together and it gets to be a collaborative effort.
Correct.
And that's part of that, looking at the holistic healthcare overall, that's what it is. It's not, mechanistic, where if someone has, we'll say heart disease, only looking to the cardiologist may only look at the heart, as opposed to saying, all right, let's look at it holistically. And
Right.
it's
In your mouth.
50%.
Yeah, the knee bone is connected to the thigh bone. Amazing.
Yes. we learned that as a child,
Right.
but somehow we forget it as adults.
Exactly.
Yes, we sure do.
So,
yeah.
the idea is, a lot of people seem to think, you would not believe the number of people who believe that holistic dentistry is healing decay with herbs.
Right.
Or doing root canals with herbs. I'm like,
Yeah.
That's not how it works. I'm not a fan of root canals.
It sounds like, if anything, it is more scientific.
Oh my gosh.
Yes.
Because
we
it's,
are crazy.
It feels
about
that way.
the
It
science.
really does.
Seriously.
because it's
crazy
looking
about science.
looking at the research, even aware of the research that you mentioned earlier about the 50% of heart attacks
Correct.
Connected to bacteria from the mouth. So it seems like it's more scientific. So instead of holistic dentistry, maybe we would rename it scientific dentistry.
I think it's more like integrative.
Integrative.
Yes,
there we go.
Integrative is a good
Integrative.
word, I think.
Well, and as you were saying that, it made me think of, I think so many people, regular dentists, not that they don't do great dentistry, but it's like you go to dental school and you learn your skill and you go out and you perform that skill, but you don't fully remember or know the full why am I doing this. And that's where we are very in our field. It's like, no, there's a why behind everything that's recommended. There's a why. It's not just, I'm cleaning your teeth because we have to clean your teeth, or I'm doing this filling because we have to do the filling. Well, why did you need this filling?
Why did you
Why
get
are
the
you
cavity in the first
clenching?
place?
Asking
Why
the
are
why.
you clenching and grinding your teeth? And not just here's a night guard because you clench and grind your teeth. Well, what's the why?
I love that. And it's the same thing I'll do in our practice. If someone has a pain, it's why is the pain there, not just here's a medication to cover it up, but why is the pain there? Let's get to the cause of that. So I love the thought process, and I love that functional integrative medicine approach that you guys bring to, I want to say the dental field, but it really is dental field, but whole body, because it connects.
Well, it's multidisciplinary. It's
Yes.
like, we have the portion of the body that we help with, but at the end of the day, we have to work with chiropractors, we have to work with functional medicine doctors, we have to work with massage therapists and postural restoration therapists and myofunctional therapists, and we have to work, naturopaths, we have to work with all, because it's a team effort. Our patients are a team effort. They didn't get sick because of one thing. They got sick from a multitude of things. So our goal is to address everything eventually. I mean, obviously it's going to take time. You don't get sick in no time and then get well in no time, although some people do, but it's not.
It's a process.
It's a process. It's not an overnight thing. Our goal is simply to make sure that we deal with the oral contributions to systemic illness.
Okay, that is just so amazing. Just in our short time, just so much knowledge, and I can feel your passion, as I'm sure that our listeners can too as well.
For sure.
As we're wrapping up, because I know your time is valuable and you have patients that are waiting for you, what are some final thoughts you'd like to share with those watching today?
I think once you get exposed and think about these things and addressing your entire body, you just, I don't know, it makes me feel really good, and I feel like I just want everybody to feel that way about their health care and what they go through, and I don't even know what else to say other than that.
I'm a stage 4 cancer survivor, and I put myself into remission with IV vitamin C. I was given a year to live and a 1% chance of survival almost 6.5 years ago. So I come at it from that perspective. I don't ever want anybody to have to get that deep into it, you know, into their dysfunction, right? I don't ever want anybody to have to go down my road.
Right.
And if there's anything that we can do, because it took me 4 years to find Dr. Perry, and I think that she is amazing, right?
Thank you.
I went through several people before we realized she is the right fit for us, right? And thank you God, she believes the same of me,
Yes.
right? But at the end of the day, I don't ever want anybody to go through what I went through. And so down to the soaps in our bathroom, down to what you see me eat, if you catch me eating, you know,
Right.
I'm authentic.
Yes.
You know, now does that mean that occasionally I don't go out to eat and have dim sum? No, I occasionally do that, you know, but for the most part my diet is, and we talk about diet here, right? For the most part my diet is very clean. It's mostly plant-based, it's organic, it's, if I'm eating meat, it's grass-fed meats, if I'm drinking milk, it's raw dairy, you know, and
How many times do you hear about this from your dentist? Right?
Yeah.
As opposed to getting a sucker on the way out.
and I don't
Right.
eat sugar
And
at all.
it should be talked
my
about
goodness.
here.
You know, yeah, and we're
Right.
passionate. I started down this road with my daughter. My youngest was born and she was allergic to every single commercial formula out there, and I was so sick at the time, and I didn't realize it was mercury toxicity, right? But I was so sick, and the doctors wanted to put her on the broken down protein formula and the reflux medicine, and there was something inside of me that said, this stops now. This stops now. And so I did my research. I discovered the Weston Price Foundation and the homemade baby formula and the raw milk. We joined a raw milk group. And so that's the journey. And it took me 3 years of learning personally that conventional medicine was failing me and killing me utterly. And then I said, okay, I can't do this anymore. I no longer believe in conventional dentistry. I believe that what I'm doing is harming people, and I don't want to do that anymore. And so what do? You either quit or you find out how to marry what you do with what you believe. And I'm sole provider for my family. My husband's a stay-at-home dad. He's raising our girls. He homeschools them, right? So I had to learn to marry what I did with what I believed.
Yep.
And it has been such a journey, and painful at times and daunting at times, and you know, I wouldn't trade it for the world. I'm so incredibly grateful. I get to live. What a novel thing. I get to live. You know, and my commitment, as is Dr. Perry's, our commitment is to help our patients get their lives back.
Oh my
Yes.
goodness. I love that.
Yes.
One thing which I really loved, what you said was it just didn't feel right. We were talking about that. It just didn't feel right, and
Correct.
you needed something. I think so often that gut, that intuition, whatever you want to call it, right?
Oh, very much.
That,
it's this right
you,
in here.
You know, and if something just doesn't feel right when it comes to your health, know that that's just not something to be dismissed.
Or your
Right.
children's health.
Yes.
So often people
Ask
get
the why.
gaslight. I mean,
Yes.
good Lord, the gaslighting is terrible in the
Yes.
conventional world.
Oh my
They're
goodness.
constantly dismissing you. They're constantly telling you that everything is all in your head. I mean, I went through, oh my gosh. Back in the day, I was on, I had heart palpitations and so on and so forth, and I went to the doctor, and they said, oh, you're depressed. You're having anxiety. Here's some Wellbutrin, right? I had low vitamin D.
Not asking the why.
Yeah.
Not
Correct.
asking that why.
You know, like it never occurred to them to check my vitamin D levels. Amazing how the heart palpitations, the anxiety, I didn't really have anxiety, honestly, but the heart palpitations dramatically improved by getting my vitamin D levels up, right? So I'm a true fan of nutrition.
Yes.
True fan. Vitamin C, man, I am cancer free
Yeah.
with
that.
vitamin C.
Oh my goodness, y'all are so amazing. I'm gonna put on here a link for the Biological Dentistry Association
Yes.
that you mentioned.
We'll write it down for you.
Yes.
And then I'll also put a link directly to y'all's office as well.
Oh,
and
thank
if there's
you.
any other ways, whether it's social media or things that people can connect with you, we'll make sure we put links on there as well.
Yeah.
Again, just thank you so much for your time,
Oh,
for your
thank
passion,
you.
Pleasure. Thank
for your
you.
dedication. And
Yes.
y'all, if you're watching this, please share this. Share this with your friends, your family, your loved ones. just because this is information that is so, I would say, misunderstood, or not even understood, that is just neglected. You don't know what you don't know. And I've learned that when a doctor says there's nothing that can be done, they're making the best recommendations with the skill set they have. So by no means is this to say your current dentist or doctor is no good. It's simply saying, hey, they're doing the best they can with the knowledge they have.
Correct.
However, there is more knowledge.
I like that.
Right?
Yes.
And perhaps with where you're at right now in your health journey, you may need someone with a different skill set. And so that's our message today.
Yeah.
I like that.
Yeah, and
yes.
we know some absolutely marvelous conventional dentists.
Yes.
Love them to pieces. Nicest people ever. They just haven't gone down the road we have, you
Right.
know, and I will tell you, I don't know any biological dentists that went down this road willingly.
Right.
They got sick.
The ones that I've talked to and that I've met personally all had a story
We all got sick.
where it was they were this way and they got sick and this was the only way out.
Yeah.
And so from pain comes the passion and the purpose.
Correct.
So
Yeah.
That's, like I said, it comes not because the other dentists are less than, it's because they just simply haven't been down this road.
Right.
I don't wish it on anybody, but I'm incredibly grateful for it.
Right.
awesome.
Right.
Thank you all
Thank
so much
you.
again for your
Thank
time
you
today.
for coming.
Absolutely.
Yes.
As always, wish you the absolute best in health and wellness. Stay tuned as we have some wonderful episodes coming up in the weeks ahead. We'll see y'all then.
Thank you. Bye-bye.